Hi, it's Dr. Devi Shetty at NH Dialogues. Today we are going to discuss about one of the most important issues on healthcare, that's managing obesity. It's a big problem in our country, as you're aware, and we have requested some of the stalwarts in the area of obesity management. First of all, I would like to welcome Dr. Satish Kumar. He is the head of the Department of Endocrinology and Bariatric Medicine at the Narayana Health City in Bangalore. He was a consultant in endocrinology and bariatric medicine in England, and he is very, very keen to address the problem of obesity in India. To my right is Dr. Shubhayu Banarjee. He is the bariatric surgeon, laparoscopic surgeon and a GI surgeon at Narayana Hospital, Rabindranath Tagore Institute of Cardiac Sciences in Calcutta. Dr. Banerjee is going to talk to you about the surgical treatment for obesity. To my extreme right is Dr. Ashwin Kumar Kudari. He is a GI surgeon who is an expert in bariatric surgery and laparoscopic surgery. He does amazing work with the laparoscopes. Things what I thought wasn't possible, he is doing it. Congratulations, Ashwin, and welcome, Shubhayu.
Thank you.
Satish.
Thank you. Thank you.
Now, interestingly, Satish told me that we have received over 500 questions in the last few days. That just shows the amount of interest people have in managing obesity. It's a big problem. Indeed, it's a big problem. Satish, I would like to start with you. Muhammad Chowdhury from Dhaka, Bangladesh, has asked a very simple question. What is obesity?
Okay. It's a very interesting and very important question. And everywhere we keep saying obesity, obesity, and what is the limit to say what is normal and what is obese. Obesity in general is called excess of body fat. In day-to-day activities, we cannot exactly identify amount of fat. Even though we have the instruments to calculate everything, it is not possible day-to-day. For that, we calculate what we call body mass index that gives an approximate estimation of body fat. In adults and children above 2 years, we use body mass index. It is calculated by using weight in kilograms by meter squared. Height. And height in meter squared. That gives us clear information about BMI. In case of adults, BMI, which is between 18.5 to 24.9, is normal. And anything which is between 25 and 29.5 is overweight. Anything above 30 is called obesity. Of course, there are different categories of obesity, which we can see later on if there is a need. And in case of children above 2 years, because children grow both height and weight, we cannot take one single standard as normal for that child. We have reference ranges for age and sex matched. We need to calculate. And in India, whatever the calculation I told you about BMI, that is good throughout the world except in India, particularly in Asians, because with the same body weight, we are at high risk of developing various heart-related problems, diabetes and hypertension. This standard is changed clearly. Up to 23 is considered as normal. Anything which is above 23 up to 27 is excess body weight or overweight. Above 27 is obesity.
Ashwin, there is a question for you. This is about bariatric surgery. What is bariatric surgery?
Bariatric surgery is a group of surgeries, various procedures, surgical procedures, which are done to reduce the weight. there are many procedures available, like restrictive procedures, malabsorptive procedures, or combination of restrictive and malabsorptive procedures. But it should be differentiated from liposuction, which is cosmetic surgery, which is it is not equivalent to a bariatric surgery.
Shubhayu, the Vikas from Mumbai, he says his parents are obese. He wants to know whether obesity is hereditary.
A very good question. From various studies, it is very clearly known that up to 30 to 50% of conditions and variability in fat composition in the body is depending upon the genetic inheritance. That is one aspect. And there are a lot of genetic mutations, that is genetic syndromes we have, and we have single gene mutations that can also cause overweight and obesity. Particularly whenever we see genetic background and or syndromic background, we can see various other aspects like short stature, mental retardation, blindness, and various other conditions. They are a totally different group of mutational conditions. We do have a single gene mutations which we commonly see in general public, that is called leptin deficiency, leptin receptor deficiency, and ineffectiveness of the leptin to act. These are all some of the conditions
Satish,
which we do.
I want to know what percentage of the obesity is hereditary?
It's very difficult to clearly pinpoint the
But hereditary
obesity.
is not a big issue.
It's not a big issue, but most of them will have a genetic predisposition. Yeah.
Fine. The Shubhayu, one of the patient, he says, I weigh 122 kilos and I want to undergo bariatric surgery. And he has only one question. How risky is the operation?
Well, first and foremost, I would like to say, like any other surgery, bariatric surgery has its risks. But what we say before I talk about the surgery, this subset of patients would have high blood pressure, diabetes, obstructive sleep apnea, thyroid problem, and probably asthma. So before even thinking about surgery, we need to risk stratify and probably manage these conditions before. So before embarking on surgery, these patients need to have an ECG and an echo to assess, is their heart up to this surgery? What is their thyroid functions like? How good is their glycemic control? What is their lungs like? Do they snore at night? Once we have all these things in perspective and we have actually treated them, then we can talk about the surgery, their hopes and expectations. The internationally quoted figure now is less than 1% in terms
That's what
of
I want to
mortality.
Hear. Shubhayu, I'm very happy that you have mentioned that the risk of bariatric surgery in an ideal condition, ideal environment, is less than 1%.
Absolutely.
That's a very, very acceptable risk. But you are also putting a clause that they need to undergo detailed evaluation of their cardiovascular system.
Without a shadow of doubt, because again, in our experience, we know this sort of surgery has to have a tertiary care background where you have an on-call cardiologist, very experienced intensivist, very good anesthetic cover. Because the problems these patients face post-surgery are either due to the heart or to their lungs. They might have an acute coronary syndrome or they might have a pneumonia. So you need to have facilities in the same setup where you have a 24-hour cath lab, where if patient has an MI, they can have an urgent angiogram. So these are the things we have to bear in mind before offering this patient surgery and counsel them and their relatives accordingly.
So you are suggesting that bariatric surgery, to get the best results, it has to be done in a tertiary care centers where they have a very large, very, very experienced specialist in dealing with cardiac problems, lung problems, and other problems what can happen in these patients.
Absolutely, without a shadow of doubt, because we are dealing with patients who are 3 times, 4 times their normal body weight, and as we know, the strain or the response to this sort of surgery is different. There are normal patients having a gallbladder surgery or a hernia surgery. So yes, we do need to have very experienced backup in case they have a problem.
Satish, there is a very interesting question from a gentleman called Rahul Gai from Bangalore. He says, I am 22 years old and I weigh 114 kilos. I have no problems and lead a normal life. Why all this hue and cry about obesity?
Yeah, it's a very, very interesting question. As his age is 22 years, that's a very good young adult who do not have any problems. And as we discussed earlier on, obesity is associated with a number of medical problems. It need not develop early in the age when they are young and healthy. As the years progresses, they develop various conditions, particularly diabetes, high blood pressure, and cardiovascular conditions. And as the age progresses, there are a lot of other medical conditions like multiple episodes of gallstones, arthritis of the knees, and breathing related problem, asthma, obstructive sleep apnea, that leads into other problems like hypertension. This is one side. Majority of them will have problems. And the second side is question also is fair. There are two different types of obesity. There are few people who have excess of fat accumulation around the buttocks and thighs. And from various studies, it shows that they may not be at very high risk of developing various problems. But as far as India is concerned, quite a lot of, majority of them who are abdominal obesity. That means belly will be a little bit extension and most of the fat is accumulated within the abdomen. They are the people who have very significant problems. That is why we need to deal all these problems even before they develop any of these medical conditions.
Thanks.
I
Thanks.
may add some.
Sure.
There is an interesting data in the obesity surgery. It may not apply to him, but it says that a person who undergoes obesity surgery at an earlier age, he will have a maximum benefit from it compared to a person who undergoes surgery at the age of 60 years. A person who undergoes a surgery at a younger age is at a he has a survival benefit. He may not have complications because of diabetes, hypertension, all those things. So since he is very young, 20 years, he has to even though he doesn't have any problems, he has to address it at this age, so to have a maximum benefit.
Yeah.
Just to add on to that, Dr. Satish, I would just like to your experience. Long-standing, I get asked this question, long-standing diabetics, their results and effects on surgery, and if you have a diabetic which is shorter duration, their results are much better.
Yes.
So in your experience, would you recommend that diabetics 2 to 3 years who are obese, they would benefit better in surgery, with bariatric surgery, than those who have been a long-standing diabetics?
Absolutely, as you say. And in the early stages of type 2 diabetes, you still have enough of beta cell preserved. And when you do the bariatric surgery, there is a chance that they may not require any treatment afterwards. Even if they undergo bariatric surgery by 5 years also, still their requirement of treatment may go down significantly and their control would be much, much better.
Thanks. Ashwin, there is a question for you from Prema Reddy from Hyderabad. She says she has diabetes and she is obese. Would bariatric surgery cure me of my diabetes? This is the common question which a lot of people want to ask you, because see, all along it's a traditional teaching that once you are a diabetic, you are going to be diabetic for a lifetime. And of late I have been hearing that there is a cure for diabetes. You undergo bariatric surgery if you are obese and you will be cured of diabetes. Is it true?
Yes, sir. It's an interesting question. Initially the weight loss surgery started only for the reduction of the weight. But over a period of time, there was an improvement in the diabetes, the drug requirement was not there for some patients, and there was also improvement in hypertension, sleep apnea, and all those things. And over a period of time, now the bariatric surgery has changed into it is now called metabolic surgery, because apart from weight loss, there will be improvement in diabetes. Nowadays it is called a surgical cure for diabetes. Those who are obese, whose BMI is about 32.5, and diabetics, type 2 diabetes, which is obesity related diabetes, about 80% of the people will get a cure, and about 20% there will be reduction in the requirement of the medicines for diabetes, either insulin or oral hypoglycemic agents. So it can offer a surgical cure in about 80% of type 2 diabetes.
That's really amazing, Ashwin. If you can tell people that 80% of the time following bariatric surgery, a person who has been taking insulin, very high doses of medicines, he can stop the insulin, he can stop medicine. That's a great relief. I am amazed at the progress we are making in healthcare. I have been watching the complications of diabetes for all along. It's a dreadful disease. Now you are saying there is a cure. Congratulations, I am very happy.
Just to add on a little bit to Dr. Ashwin Kumar, and as you rightly said, Dr. Ashwini, those who are diabetic and overweight, if their diabetes is because of the overweight and obesity, and if they are responders, they respond even within 3 days, even before they get a discharge from the hospital, their blood sugar becomes normal in number of patients.
It's amazing.
So
it's
And that is no way related to weight reduction. There are quite a lot of changes that happens in the hormonal things in the GI system that is responsible for this reduction in blood pressure and reduction in blood sugar.
Excellent.
After seeing these results, now even though the BMI is less than 32.5, but the diabetes is so worse that it is not controlled with medicines, oral medicines, insulin. Sometimes we offer this bariatric surgery as an alternative, or to get the sugars into a better control, even if it is less than 32.
I think in Indian setting there is a slight shift, a paradigm shift in terms of diabetics with BMI, and now we can say safely even 32.5 BMI, as you rightly said, refractory to treatment with insulin and all, we still offer them surgery. And in my experience, patients have gone home day 3, day 4, 38-year-olds, insulin 30 BD, have stopped it completely. So A, we are reducing healthcare cost, B, the quality of life, and C, all the readmissions and the workforce related problems.
Shubhayu, if you are saying that a obese, not so obese, diabetic, who's struggling to control his diabetes, you do an operation with the risk of less than 1%, and in 3 days he walks out of the hospital non-diabetic, that's amazing. That's truly amazing according to me. Because there are very few surgeries which can cure people, and this is something which everyone should know.
Absolutely.
Thanks.
And
Congratulations
number of
to
diabetics are
all
in
of
India.
you. Dr. Satish, there is a question for you from Muhammad Afsar Ali from Chittagong.
Mm-hmm.
He has a very simple question. What causes obesity?
Yeah. Very interesting question, and to that, there are various different causes for obesity, among which, as we discussed, one among them would be genetic, that is, runs in families. That is one thing, inherited one. And the second one is, most of the time in the present situation, and sedentary lifestyle, that is one of the important things, and no physical activity, that is the second thing. And third one is fast foods and high calorie, fast food, and a high calorie diet. Okay. High calorie diet, which is available everywhere in the schools and workplaces and all the places. That is one of the main causes. Apart from that, there are various hormonal imbalances that can cause overweight, and among the general public, they are very well aware of thyroid problems that can cause overweight and obesity, and various other hormonal related problems can also cause overweight and obesity.
Thanks, Satish. Shubhayu, a young lady from West Bengal, that's where you practice. Her name is Sushmita. She says, in her own words, I have a very busy schedule. How many days will I have to stay in the hospital and then away from work if I have to undergo bariatric surgery?
Generally, in our practice, we say that the hospital admission is for 4 days. So, if you get admitted the night before the surgery, you have your surgery in the morning. So, generally, rule of thumb is day 3, day 4, you get discharged, and if all goes well. Time of work, again, how comfortable you are, what sort of work you're doing, how strenuous your activity is. But if it's an office-based work where you're sitting on a computer, we generally say 7 to 10 days and you're back to your normal life.
That's very interesting. After a bariatric surgery, they can go back to work in 7 to 10 days.
I would say so. Would you agree with me?
Yeah, definitely. That is 7 to 10 days is absolutely...
It's amazing. I'm very happy to hear that this is the kind of, because my idea about bariatric surgery was dramatically different than after talking to you guys. Anyway, I'm glad I'm not a bariatric surgeon. Shubhayu, there is a question from Arifur Salim from Sudan. His question is, what is the amount of weight loss expected after bariatric surgery? How much weight they can lose following?
That's a very interesting question, but the first thing to know is what your body weight is prior to surgery and what your BMI is. So as a rule of thumb, as surgeons, we say that suppose your body weight is 80 kgs more than normal. In that case, as surgeons, we quote a figure of around 60 to 80% of weight loss by the end of 2 years. So you would lose around 60 kgs by the end of 2 years. That's what we quote. But then again, there are little subsets or caveats in that, how compliant you were also. Because surgery is also, apart from surgery, there are adjuncts. Have you been following your diet strictly as advised by your bariatric surgeon and physician? How much exercise you have done? We can do the surgery, but what we have to remember, and what as patients you have to remember, is it's a commitment. It's a commitment for life. So you have to still be on the diet, be on your exercise, and we will help you to reach there.
Shubhayu, you can lose 60 kilos of weight following bariatric surgery.
Indeed, I think in our experience,
it is 50 to 75% of your excess body weight.
Yeah.
If your weight is 120 and your ideal weight is 70, so the excess weight is 50 kgs. So of these 50 kgs, you lose about 50% to 75%, depending on the compliance as diet and exercise. It is not surgery alone. People should not think that I have undergone bariatric surgery, I don't have any role to play. It is a combined effect of surgery, diet and exercise.
Excellent.
And I think that also depends on what type of surgery, as we have different types of sleeve gastrectomy and bypass surgery. Depending upon what procedure we are doing, they have weight loss.
Excellent. Satish, there is a question for you from Karthik from Mysore. He says, I am scared to undergo surgery. I don't blame you, Satish. Is there any other way to lose weight?
Yes, indeed. We can try various other things even before we enter into the decision of bariatric surgery. Initially, diet, physical activity, behavioral modification, that is changing the lifestyle of a person, and if needed, we do use medication. At the moment in India, we have only 1 or 2 medications. Though there are a lot of other medications licensed by FDA, we don't use all those things in India, mainly because of the side effects associated with that. And with medication, and as I suggested, following a strict diet, depending upon the person, depending upon their activity level, depending upon their lifestyle, we advise different types of diet modification. And with that, we advise programmed exercise pattern with the help of our physiotherapist. and then we advise various lifestyle modification. Indeed, if there is a need, we do take help from psychiatrists to give a therapy called cognitive behavioral therapy. That has a role in obesity management. And one more important thing, when we are talking about without bariatric surgery, though we can use any of these things, even for people who are preparing for bariatric surgery, these things are very essential even before they undergo surgery.
What you just touched on, and it's just enhancing, this entire thing about bariatric surgery is an approach of multidisciplinary team. So it's not the surgeon, it starts from the physician to your dietitian, to your psychologist, to your counselor. So it's the entire team which is involved in this patient care. And that has to be emphasized once again. Until and unless you have a proper team, you cannot have success.
Shubhayu, there is a question from Chetan Vasant from Vadodara, Gujarat. His question is, can I eat the same kind of food after surgery, or should I follow a separate diet?
Chetan, the answer is not that straightforward. What as surgeons we do, we start letting you drink water the day after surgery. But slowly, for the first 1 month, we advise you to be on a liquid diet. And we exactly tell you what calorific inputs you require along with your dietitians. After that, you can slowly start building onto solid food. But before that, again, you have to bear in mind the commitment. So you should be on a pureed diet like children of first 6 months the babies eat. And then slowly and steadily, you can build up and eat what you ate before your surgery. But the most important thing is the quantity has to be really less, because you would not be able to eat. That is one acceptance you have to make prior to the surgery, and that is your commitment you have to keep.
Thank you. Satish, there is a question from Mallika Inamdar from Delhi. I have hypothyroidism and I am taking medicines regularly. Still, I am not losing weight. What do I do?
Yeah, it's a very common question. Every patient, hypothyroid patient, asks me. And you should understand that thyroid is one of the commonest problems which we have been seeing in the society. And there is a slight misconception that all thyroid problems would increase body weight. And of course, hypothyroidism can increase body weight, and only if it is very severe and if it is not treated properly. Once a person takes medication and the thyroid levels comes back to normal, and it has no effect on any of the body weight, whether they are losing body weight or gaining body weight, it does not have any effect.
Thanks, Satish. Yeah.
Thank you.
I want to talk to the surgeons here. Most of the patients I treat in my practice, they're not rich people. They are working class patients. The biggest problem which most patients face is the cost of these operations. So if I have a patient coming from lower middle class or working class families who can't afford to write a big check for you for a bariatric surgery, how much you can do an operation for? I'm not talking about the rich people who want all the comforts. I'm talking about a patient from a working class background who is very happy to be treated in your general ward, no problem. How much it will cost you, Ashwin?
It is a very most commonly asked question. Even in my practice, people who come, they ask about the cost factor.
I know you operate on a lot of rich people and influential people, but you all have to operate on these patients as well, because obesity, Ashwin, you know, it is not the disease only of the rich people. Today, large number of poor people are also obese.
So, first I would like to start by saying that most of the results which, less than 1% of the complication rate are achieved by laparoscopic surgery. Initially, it all started with open surgery, but it was associated with high morbidity and mortality rate also, significant mortality rate also. All the advances which have happened are because of the advent of laparoscopic surgery and improvement in the technology. So we use some things called staplers in the laparoscopic surgery.
I wanted to do a very safe operation on me.
Safe. That is why.
But what is the least amount of money I can pay you, Ashwin?
So it all varies from procedure to procedure, but I can say that it varies from 2 lakh rupees to 3 lakh rupees in the hospital, from the date of admission to the date of discharge, including medicines.
Excellent. So if you have about 2 to 3 lakh rupees, you can do a very safe bariatric surgery.
Yes, sir.
Okay.
Yeah.
Without all these comforts of deluxe room and all the other. Shubhayu, you have anything to say?
The only thing I do tell my patients is when they hear this 2 to 3 lakhs, I think around 40% of this is the consumables or the staplers we are using.
Okay.
And to make the surgery safe, we cannot cut corners. So
I agree with you.
So for that, if you're using 6 staplers, 5 or 6 or 7, these staplers are costing money, nothing else. So I think
these staplers are all imported, isn't it?
These staplers are imported and are disposable.
Yeah.
So they are not reusable that we can use it again.
Thank you very much, Satish.
Thank you, Dr.
It's my privilege talking to you because, I admire you as an endocrinologist and a bariatric medicine expert because I have seen amazing results how you have treated your patients. Yeah. And it's my privilege talking to you, Shubhayu and Ashwin.
Thank you.
I learned a lot about bariatric surgery.
Thank you very much.
But don't be worried, I wouldn't like to do any bariatric surgery. Thank you very much.
Thank you.
Thank you very
It's been
much
a pleasure.
for listening to my colleagues who are the doctors with magic in their fingers. And if any one of your friend or a family member suffers from obesity, you can consult them. Thank you once again from NH Dialogues.